How are anatomical joints classified by type? Have you ever wondered how our bodies allow for movement and stability? The answer lies in the fascinating world of anatomical joints. Let's break down how these joints are classified and what that means for our skeletal system. Anatomical joints are primarily classified based on their structure and function. Structurally, we can identify three main types: fibrous, cartilaginous, and synovial joints. Each type has unique characteristics that determine how they work. Starting with fibrous joints, these are connected by dense connective tissue and do not have a joint cavity. They generally allow little to no movement. A great example is the sutures found in the skull, which provide stability to protect the brain. Another type is syndesmoses, where bones are connected by ligaments, like the tibia and fibula in your lower leg. Lastly, gomphoses are peg-and-socket joints, such as where your teeth fit into their sockets. Next, we have cartilaginous joints. These joints are connected by cartilage, either hyaline or fibrocartilage, and also lack a joint cavity. They allow for more movement than fibrous joints but less than synovial joints. A couple of examples include the intervertebral discs in your spine and the pubic symphysis, which connects the two sides of your pelvis. Now, let's talk about synovial joints. These joints are the most complex and movable type. They feature a fluid-filled cavity known as the synovial cavity. This fluid lubricates the joint, allowing for smooth movement. Synovial joints can be further classified based on the types of movement they allow and the shapes of the surfaces that meet. Functionally, joints can be categorized by the degree of movement they permit. Synarthroses are immovable joints, like the sutures in the skull. Amphiarthroses allow slight movement, which you can see in the joints between your vertebrae. Diarthroses are freely movable joints, primarily found in synovial joints, allowing a wide range of motion. Within synovial joints, there are several types based on movement. Hinge joints allow movement in one plane, like flexion and extension, and can be seen in the elbow and knee. Pivot joints permit rotation around a single axis, such as the joint between the first and second cervical vertebrae in your neck. Condyloid joints allow movement into planes, enabling actions like flexion, extension, abduction, and adduction. An example of this is the knuckle joints in your hands. Saddle joints also permit movement into planes but offer a greater range, like the thumb joint that allows for opposition. Ball and socket joints are the most versatile, allowing movement in multiple axes and planes, including rotation. The shoulder and hip joints are prime examples of this type. Lastly, planar joints, also known as gliding joints, allow sliding movements between flat bone surfaces, like those between the carpal bones in your wrist. Understanding these classifications is essential for grasping how the skeletal system supports both movement and stability. Each joint type plays a specific role in our daily activities, from simple tasks to complex movements. Knowing how they work can also help in recognizing joint disorders and guiding treatments.